When looking at the arthrokinematics of the sterno-clavicular joint, there's two motions that have to happen. When a person shrugs their shoulders, the proximal ends of the clavicle are supposed to move inferiorly. When they pull their shoulders forward, like that, the proximal ends of the clavicle are supposed to move posteriorly. When that doesn't happen, that's going to mess up the mechanics of the shoulder. And although this is not a shoulder course, this is a technique that will fix some things that most PTs kind of ignore when they're looking at shoulder function. So let's take a look at this. You're going to take your index fingers or your thumbs, and what you're going to do is you're going to place them right at the proximal end of the clavicle. There's the sternal notch right there. Move to the side, and you can see that there's a little bit of an elevation on the left side. All right? Now, automatically, I've got a little bit of a problem, but that's okay. As I have her shrug her shoulders up in the air, the right side drops down, as it's supposed to. The left side didn't move. Actually, the separation got bigger. So I can deduct from that, and down you go, that she's got dysfunction on the left side. The left side did not drop down the way it was supposed to. Now, there's another direction for that. If she shrugs her shoulders forward, and I'm going to do it first, you shrug your shoulders forward, those proximal ends of the clavicle are supposed to move posterior in the body. Let's check and see. I'll put my thumbs right on the anterior part of the proximal portion of the clavicle, right at the sterno-clavicular joint, and she rolls her shoulders forward, and in fact, her left side didn't move back as it's supposed to, but the right side did. So again, there's two components of dysfunction that have to be treated. The treatment is actually pretty simple. All right? I've got to get this proximal clavicle on the left side to move downward. And there's a couple of ways I can do it. One of the ways is I bring the arm up over her head and I just put a little pressure there, like just a pound or two of pressure, and I push down toward her feet. I can use my thumb, whatever she's comfortable with, and I bring the shoulder back until I feel it move. Now this is articular, so guess what? We're going to go to the barrier and back off. Remember, with muscle energy, you go to the barrier and you go beyond it. With articular muscle energy, we go to the barrier and we back off. So here we go. Here's my barrier. As I do that with the arm, I feel the clavicle want to drop down. It binds up. And I'll just tap her on the wrist and say, pull up with about a pound of pressure. That's it. As she does that, I can glide her down. I glide that proximal end of the clavicle down. 8, 7, 6, 5, 4, 3, 2, 1. I have her relax and take a nice deep breath. Good. There you go. Good. And then I can move her into a little bit more flexion, a little bit more elevation. Oh, there's my new barrier. I back off. I push on her again. Say she just pushes to the ceiling with a pound of muscle contraction. That's great. For 8, 7, 6, 5, 4, 3, 2, 1. Release. Take a deep breath. Good. And I do this 4 or 5 more times. And then what I do is I check my work, as you always do. So I'm going to come up like now, and I'm going to put my fingers right here, and they're even. Now I'm going to check and see if I got her position better, but maybe there's still some hypomobility. So shrug your shoulders up, and in fact, it drops down in. It dropped down in very nicely, okay? And that's what we wanted it to do. Good, and down you go. Now let's check the part that was going this way. I'm going to put my thumbs here. I'm going to have her roll her shoulders forward, and they didn't separate out like they did before. It actually, treating the first one, actually went back and fixed this one. The first one was worse. All right? If I wanted to fix this one, all I would do